Okay, for all you Bison fans, it's about to be horns up. That's right. Kylie Hall is operations director for the NDSU Department of Public Health Center for Immunization Research and Education. We haven't touched base on where we're at when it comes to vaccinations and the strategy. And, I think everybody's just starting to take it for granted and not even think about it. Well, there's talk of another booster and some other things. So we wanted to visit with Kylie. Kylie, good to have you coming down the road with us.
Thanks for having me back.
Want to talk a little bit about where we're at with the vaccine strategy. How is this shaking out right now?
So if you've been following the news over the last week or so, the FDA and CDC have both signed off on a second booster now for everyone 50 and older. It's a May recommendation. So if you're 50 or older, you may get your second booster. So anybody who's had that first one, it's been more than 4 months, they can go out and get that booster if they want it. There are certainly some considerations to take in mind that we can talk about today, but it's all about giving people protection that need it, especially as the BA2 variant takes hold in the United States. We don't know what that's going to look like, whether we'll have a lot of cases, just a few cases, but it's about giving people protection if they want it and if they feel they need it.
Okay, so the Federal Advisory Committee of outside experts, meeting, they met today to talk about the strategy. We talked to each other before we went on air here, and I myself, unless it's a facility where, I know I'm going to have to wear a mask, I don't even put a mask in my pocket anymore. I went to see a couple, a friend and a mother-in-law at Sanford Hospital the other day, and I was like, whoo, halfway there, had to walk back to my pickup to get my mask. Is America and this region over COVID?
I think there are a lot of people who have moved on from the basic pandemic restrictions of mask wearing. I would say I'm very much like you, Joel, where right now I'm going into the grocery store and I'm actually not wearing a mask either. I'm not wearing one at work. Certainly when I'm going into like a healthcare setting, I would bring one with me. I'm ready to take that mask back out. Should cases go up, should test positivity go back up, hospitalizations increase. But, for right now, I feel like personally I'm fairly low risk. I've had 3 doses of the vaccine. Cases are low in Cass County where I live. And so for right now, I've relaxed my restrictions, but I'm prepared to bring those things back out should I feel that they're necessary.
Okay, so I'm 60 years old. I've had 4 doses of the vaccine. I would say, no, 3, 2, then the booster. And now the booster, another booster is available to me. What would you recommend? Should I be stopping at my clinic? Should I be stopping at my pharmacy and saying, all right, hit me with another one?
Yeah. So ultimately, I think this is a conversation that should happen between you and your healthcare provider. What I've been thinking about and what I've been, thinking about, what would I tell my parents? What would I tell my friends and family? First and foremost, age is going to be one of your biggest risk factors for severe disease, which is why this recommendation has been made for people 50 and older. So the older you are, I think the more you should be considering getting that second booster. Secondly, I'd be looking at underlying health conditions. So do you have, chronic heart disease, lung disease? Are you diabetic? Are you overweight? Any of those conditions, I would be walking a little bit faster to go and get that next booster dose. I also think you should consider, have you had COVID previously? And especially if you've had the Omicron variant. So if you were infected and you had COVID December of 2021 or even January of 2022 and beyond, if you've had 3 doses and you've had the Omicron variant, I actually think at this point in time, there's very little evidence that you need that booster right now. Now, give it another month or two, give it, 6 months past your infection. I think that's another story and something you'd want to talk about with your healthcare provider. But essentially being infected with Omicron gave your immune system that natural boost. And so if you had an Omicron infection at this point in time, I don't think that booster is necessary. But again, if you maybe had Omicron in December or January, you're in a long-term care facility and you're 80 years old, I think there is some benefit to getting this next booster and very little risk associated with it. So it's very personal. It's having that conversation with your healthcare provider, but those are some of the things that I would be thinking about when you're weighing that decision.
Is there any way that that you can find out, or at least have a survey done so that you know the percentage, no different than polling in a political race or anything else, the number of people that have had COVID. I mean, I've had COVID. I don't know if you've had COVID, but a lot of the people I know, I would say more of the people I know have had COVID than the people I know haven't. And so, obviously highly infectious, but I'm curious, and maybe that's already done, but what percentage of people out there contracted and have had COVID?
That's a really good question. So we can look for antibodies against the virus that causes COVID, but the presence of antibodies doesn't necessarily mean you're immune and you can't get infected again. Along the same lines, not having antibodies doesn't mean that you're not protected because we have another layer of our immune system called T cells. And so that requires an even more specialized test. Now, there are estimates out there that maybe 40 or 50% of the US population was infected with the Omicron variant, so about half. And then if you add on all of those other people who maybe had the Delta variant or the original strain, certainly I think there's a really large chunk of the American population that has been naturally infected. And then you add vaccination on top of that, and that's going to make people hopefully have even more protection. But we know that just because you've had previous infection, that doesn't necessarily protect you from future infection. And so that's why we're trying to help people understand the benefits of being vaccinated. Likely it will protect you against severe disease, hospitalization, and death. And that's what we fear the most. Might not protect you against infection, but it might make that infection a little bit more mild.
So, as a person moves forward with this, and people take it more for granted, the fact that there might be a new variant coming, that there's a new variant that could be highly infectious, is it more likely than not to be really dangerous? Or is it, as this goes on and these variants come, it actually becomes weaker?
That's a good question, and we don't know, and we have no way to predict that. So, it's favorable for the virus to become more infectious, right? As it mutates, maybe something becomes even more infectious than it is. That helps the virus spread. Certainly, you could also see the virus maybe mutate where it becomes more virulent, so it causes more severe disease. I don't know which way the virus is going to mutate. We have seen with Omicron that it's become less serious, and whether that's because a number of people have already been infected, so their second infection isn't as severe. More people have been vaccinated again, so they have some of that natural immunity. I think that, as time goes on, we'll be able to look back and pinpoint some of these things more specifically. Hopefully new variants are not as severe and they become less virulent, but it's really it's hard to predict at this point in time.
Yeah. The other question I have before I know you've got to go is, where are we at long term? Is it the belief of scientists like yourself that, this is going to be no different than what I do every year with my flu shot, which is I get the flu shot. I know the percentages. I know that I can still contract the flu. I get all of that. But the best shot I've got at not getting influenza is to get the flu shot. Is that going to be the norm with COVID?
Well, I can't say specifically how often, that next dose is going to be. I think we are going to have to live with COVID. And so we're calling it an endemic state. We're going to live with it. There's going to be ebbs and flows. There's going to be high seasons and low seasons. I think likely you're going to see it rise in the winter, maybe the late fall, which is when everybody moves indoors, similar to the flu. But, in the past, we've also seen waves in spring and summer. So hard to say. I think ultimately it's going to come down to, if you want that extra protection against COVID, you're going to be going in to get boosters. And how regular that's going to be is yet to be seen. Yeah.
Well, my suspicion, being that I was pre-med. I don't know if you know this, for almost a week. And my suspicion is we're going to end up getting a booster every year, which won't bother me. I've had 3 different shots. I'll go get this booster. I think that time has proven that all the people who feared what might happen hasn't happened. All the speculation they had that you wouldn't be able to have children, that it would get you long term, all of these things, it's just not true. I mean, it's just not true, and the science isn't behind them. And so the individuals that are out there just spewing this stuff, you know, you could make an argument for me, I'll leave you out of this, that they didn't help one bit and they probably did hurt. But that's another story for another day. Kylie, as always, thanks for giving us your time and thanks for coming on down the road.